Ladies and gentlemen, Dr. Agrawal, thank you very much for the invitation to talk here at this opening ceremony of the Integrative and Hyperthermia Cancer Therapy Center in Wroclaw. And I'm glad to be here again after several times. Now I see the rooms new, everything is nicely prepared, and I'm sure that patients feel very well when they enter here. My topic today is the role of complementary treatments in oncology, and I want to point out the differences between complementary treatment, alternative medicine, hyperthermia, and so on. We have the situation in cancer. We have cancer treatments. Which is the best treatment is always the question. It's surgery, radiation, chemotherapy, and which role does the complementary treatment play in this system? So it's not something which is done extra, it is something which is done in addition. Let's see, here's a patient with a breast cancer. She had a breast cancer 2007, and here she had the diagnosis, and she did only alternative treatments. You can see she did New Germanic medicine, Misteltoe, Rife therapy, and many other treatments, all alternative treatments. She did not go for surgery. She did not have any conventional treatment. And she had then, a year later, such a breast. You can see here. The tumor had become bigger. She had lymph nodes now, metastatic lymph nodes. And again, she did an alternative treatment, not a standard treatment. Here, at this point, surgery could maybe have helped, but she did a kind of photoimmunotherapy. And the prediction was, and you find that very often in alternative treatments, further growth and then suddenly death of the disease. But this did not happen. And you see here, this was a bit later. The breast got even better. But the patient was not desperate, because the therapist said, oh yes, it has grown, this shows it works, we have to do another round. And they made another round of the same treatment. She had now pulmonary metastasis, and this is how she came to us, with further growth, progression of lung metastasis, also liver metastasis. And she said, I believe this is automastectomy, and my chances are excellent. You see here's everything completely wrong. Yeah? And after treatment here, that was how she came. You see here after a few weeks of chemotherapy and complementary treatments, you see the tumor has shrunk significantly, also the lung metastasis. So very clearly, the conventional therapy has shown that it has up to now shown the best successes in the treatments up to now in terms of cancer. For example, breast cancer. Early detection, early surgery is necessary here, for example, mammography. And then if you have surgery early, you have cure. And you see here, these are the improvements over in the last 35 years. And you can see the curves, the lower curves are always an improvement which has been shown. But we have to tell the improvement is mainly because the methods of early detection is better. Yeah? The treatment, if it's metastatic treatment, the improvement is not so much. And here you have a curve of patients with metastatic breast cancer and metastasis in several organs. And you see here, depending at what date the diagnosis of metastatic cancer was made and the different treatments available. And you can see it doesn't matter if the disease was detected 1980 or in the year 2000, the 10-year survival rate is the same, which means even though you have more and more expensive chemotherapies, the result is zero, the improvement is zero, which means the newest chemotherapies and all the high costs, they are not really worth to be done, to be spent. So complementary treatments, a question of confidence, and this is another problem in the medicine. We have about 80% of all patients with cancer, they ask and look for complementary treatments. And how many percent of the patients tell that to their doctor? This is a big question, and most of the patients don't even tell to their doctor that they use complementary treatments. Because they don't have the confidence. And the confidence depends, between patient and doctor depends that the doctor gives a competent guidance, that he has an attitude open to complementary treatments, and that he has knowledge about the complementary treatments. And why is complementary medicine not taught at the university? Maybe because of the modern medicine favorizes aggressive treatments, like surgery. Here you see, for example, very modern techniques. But this is not all. You see, in the old times, we had female herbalists, and I don't mean female herbalists, And this is historically, and they were known very well by the people, and they did good treatments. And later on, and they had the help 2 ways, either with the help of God, the one side, or that was in the Inquisition in the mid-centuries. They were witches, so they were women, and they knew about cancer treatments and alternative treatments. And maybe this is the reason why complementary treatments are not accepted, because the modern medicine still has this thought, okay, this has something to do with this here, witch or God. And you see the modern medicine is having the battle against the disease, killing the disease, whereas the complementary treatment is more the female aspect, regeneration, arrangement with the disease. This is also kind of male-female aspect. Here's a big study showing that if patients don't follow evidence-based guidelines, that they have a worse outcome. And the question is, why don't some patients use the guidelines? They don't use the guidelines because they are afraid of the side effects of certain therapies and afraid of the chemotherapy, of radiation, of surgery. And this can be dangerous for the patient if they deny to follow the guidelines. Then the only solution is for the doctor to respect the fears of the patient, to discuss about alternative treatments. And if you ask your doctor, which doctor will discuss alternative treatments with you, maybe no doctor has any idea about that. And accept also the decision of the patient not to follow maybe the guideline, but offer a monitoring. Say, okay, you don't want surgery now, okay, let's see again in 2 months and then decide, because this then still can be helped. Is it wrong to perform alternative or complementary therapies? You see here many treatments which are very well known: homeopathy, diet, acupuncture. You see here mistletoe treatments or Japanese mushroom therapy. These are quite common alternative or complementary treatments. And there's always a confusion which is what is what. There's a biological therapy, supportive therapy, holistic therapy, complementary treatment, and alternative therapy. This is a bit a mix-up in the definition what you do. And we can clarify that the academic medicine has a focused destruction or control of tumor tissue based on scientific studies. The complementary medicine focuses support of the body and the immune system to better fight against the disease, and is based on traditional good experiences with certain methods, let's say, for example, physiotherapy, and also scientific studies. And there's an alternative sector. The alternative, these are therapists sometimes with a very unique opinion about cancer and treating cancer, and they just claim, but they have no proof, and there are no successes which can be verified in studies. So these are the 3 places. And here I show you some of these alternative medicines. Here, for example, miracle cure. If you see something like that, miracle cure, we don't have miracle cures, and this is usually wrong. And what they write here, all patients who get germanium, they have never metastases, so it's just wrong. It's not proven. Or here, Dr. Clark, she says every cancer is caused by parasites, and if you use a supper and a so-called supper machine, and if you don't use cosmetics, your cancer will go. This is also, of course, not a cure of cancer. Or here, this is a Gerson therapy. Gerson is a German doctor who said that if you can cure cancer by coffee enemas, and also by having only fruit and vegetable juices. But the result, this is also not proven, and the results is that the patients lose weight, and it's sometimes a dangerous diet for them. So the Gerson therapy is difficult to follow in its full extent. Or the Budwig diet is again a claim. You have the flax oil and cottage cheese, and you can treat cancer with that, but it's a diet which is not better than any other whole grain diet, and you cannot expect a cure from that. Or here's a world without cancer, the story of vitamin B17, which is not a vitamin, but is coming up now with the internet again, and claiming that they can cure cancer, amygdalin. Also here, it's just very early studies had shown that it could, in some mice models, have some benefit, but not for human beings. But it's sold very expensive, and you can, of course, no cure of cancer. You just lose time if you do these methods. And here the last one, Dr. Harmer, he says every cancer is just the result, the symptom of a conflict, and if you solve the conflict in your family, the conflict situation, then the cancer is cured. Very simple, and if you don't solve the conflict, it's your fault. then, but the method is always correct. So this is, of course, nothing we can offer and nothing we should offer for patients. What we offer is a complementary treatment program. You see here, these are naturopathic treatments, immunotherapy, homeopathy, physiotherapy, hyperthermia, but also traditional Chinese medicine has some aspects, psychology, dietetic treatment, and so on. These are the complementary treatments which can be used by patients in addition to the conventional therapy. Do complementary treatments make sense? Yes, they can improve, or that's what the claim is, and we will go through that. Improvement of chances of cure by stabilization of the immune system, is that correct? Less side effects after conventional treatments if you do complementary treatments in addition? Is there an improvement of quality of life? And is an holistic approach better than just the normal standard approach? This all sounds very plausible, but is there also evidence that this works? Yes, there is evidence. First, let's talk about could complementary treatments be dangerous? Yes, sometimes they can be dangerous if they are done as a single therapy at the wrong time. For example, if a possibly successful treatment is missed, let's say you do a Misteltoe treatment, a herbal treatment instead of chemotherapy in metastatic breast cancer. Or if a promising therapy is not done or delayed, for example, magnetic field therapy in bone metastasis, and then you do magnetic field therapy and the bone fracturizes, then you miss the treatment. And if a curative treatment is missed, for example, homeopathy instead of surgery of early detected breast cancer, big mistake, this should not happen. Or if the effect of conventional treatment is counteracted, for example, high doses of vitamins during radiation or grapefruit juice during oral chemotherapy, this can be sometimes bad effects. Here you see patients who did, for example, this lady did homeopathic treatment for breast cancer and the black sulfur, a special cream, and you see the result after that. That was the wrong treatment at the wrong time. She came to us later on, we could treat her in a successful way, but here she missed the chance of a cure. And here another lady, she had a bad metastasis in the bones of her lumbar spine, and she had magnet field treatment, got worse, and then she came to us, and we did right away here a surgical stabilization of the spine, which should have been done earlier. Can chemotherapy be optimized? Yes, it can be optimized. The efficacy of chemotherapy and radiation can be optimized by hyperthermia treatment, by using certain synthesizers, by chronobiological applications of chemotherapy. Side effects can be reduced by complementary treatments. This has been shown in many studies and also in a holistic setting. And improvement of the general situation, it has shown that supportive and detox treatments show an improvement of the quality of life of patients during the treatment. But of course, also the complementary doctor can have an influence choosing less toxic protocols. And the newest programs not always are the best and the less toxic ones. So the goal of hyperthermia treatment is enhancing the efficacy of chemotherapy and enhancing the efficacy of radiation. So here there's many research how hyperthermia is used, more than 3,000 publications in the last 20 years showing that the hyperthermia works on the intracellular level, on the tumor vessels, tumor tissue, cell membrane. So this is very well established that hyperthermia has an effect, and there are different ways to do hyperthermia. The local hyperthermia, which is offered here, it is used for example, with different devices, with microwaves, short waves, or even infrared A light, depending on the depth which you want to achieve. The shortwave irradiation, for example, the Oncotherm device has a 20 centimeter penetration, and there are also some special types of hyperthermia. And here you can see the different devices offering the hyperthermia, the local hyperthermia, the Oncotherm, the Celsius, and the BSD device, so the different companies producing the machines. Whole body hyperthermia is another type here, the Russian type of whole body hyperthermia, which doesn't look very nice, the patient in the hot water and the stuff also in a very uncomfortable position. Another good way to treat patients, there are more modern devices here, the Iratherm device from Germany, from Ardennes Institute, and you see the head is outside of the patient, and the heating up is with short wave, with infrared A irradiation. And you see here, here 2,000 watts are applied here, heating up the body up to 42 degrees Celsius. Whole body hyperthermia, in addition to the thermic effect, heating up tissue, whole body hyperthermia shows also that it has an immune system activating effect, increasing the relevant cell lines fighting tumors for example, natural killer cells, cytotoxic T cells. And all these effects last longer than 24 hours, and they happen also if you give chemotherapy at the same time. Let's go to some results of hyperthermia. This is maybe the best and best studied topics. There's cervical cancer. Here you see the vagina, and here is the cervix uteri, a large cancer. Here's the uterus. And this patient, she got radiation and local hyperthermia, and you see this was a certain time later, and here 2011, and still today the patient is free of disease. So this is looks like a cure of this disease. And the local hyperthermia plus radiation, these two, is a standard therapy accepted in Holland and also paid there by the social health insurances. But up to now only in Holland. In other countries they are still working on this. Here you see the results. There's a higher complete remission rate of 87 versus 57%, and the 3-year survival is increased, nearly doubled from 27% to 51%. So a very good outcome here. Here's another patient with a cervical cancer. You see the large nodes here. She didn't want to have radiation, so we started a treatment with her with a chemotherapy plus local hyperthermia. And you can see a few months later, it's already better. She has now an earring again. And a few months later, 8 months later, it's completely gone. So it's a complete remission. The patient can go out, can socialize again, and has had no pain anymore. Or here, a very recent patient, a young lady from Kuala Lumpur, who had nasopharynx cancer. Here you can see it grows into the eye nerve here, and the lady was just getting blind on her left eye. And here you see after treatment, the tumor was significantly small. And look, the eye nerve is free, and the lady has regained her vision completely. She just was here for the last cycle, and now we discuss the consolidation radiation. Or here's another patient who had a rectal cancer, very large rectal cancer. Here it looks out of the rectum, the tumor, and he had refused to get a colostoma, so he had waited, had not done any other treatment. So he came to us. We made here an emergency colostoma. We started a treatment with local hyperthermia, and you can see here the good response. The big tumor here has got much smaller, and the patient could be, here the tumor is not visible anymore. The patient could get a surgery at some point. The tumor could be removed completely. The colostoma could be reversed, and the patient just phoned me recently and said that he has now still a normal bowel passage, which is if you see that, you would not expect these results. Or here also a very recent case, a lady with rectal cancer from England. She was sent home to die because she had such a large enlarged liver full of metastases, 90% of the liver tissue full with metastases. And we did here a treatment, Folfox and local hyperthermia, so chemotherapy and local hyperthermia. And you can see here a few months, 3 months later, we see more. Now it's already 50% of the liver has regenerated. This has become better. You can see the high tumor markers, how they drop down from 5,000 to 55. So very good results. The lady is still alive. They had told her back home 2 weeks to live. Now we have more than 6. We have now 10 months since then. So it's a long time. And she's very fit. Just was at the hospital yesterday and got a maintenance treatment. Then after that went for shopping. Or here, a patient with pleural mesothelioma, a disease very difficult to treat. You see the lung here is blocked by these large tumors, and he got local hyperthermia. He had cough and he could not breathe properly. And then he had treatment with carboplatin, Gemzar, at low doses because he didn't tolerate it well, and local hyperthermia. And you can see here the result that the large tumors have shrunk, and now we discuss if surgery is an option for him. And here also some other patient here, breast cancer with liver metastasis, bone metastasis, treated with whole body hyperthermia and chemotherapy. You can see the red, these are the metastases, and here the white, this is all more or less gone and improved. Or here is another lady with this large tumor involvement of the breasts. She also had not done any conventional treatments before and got chemotherapy and hyperthermia, whole body hyperthermia, and you can see these big tumors are gone. Here's a small study showing that with using in metastatic breast cancer, whole body hyperthermia together with chemotherapy, we had in the study population we had about 70 to 80% success rates, which means control of the disease, shrinkage of the tumors, improvement of the situation. These are very good numbers, and if you look at all other studies, they cannot be achieved, these numbers, with normal conventional treatments, especially not with a very expensive new and modern treatment. And here the last patient, a lady with ovarian cancer from Greece. She came with this big tumors here in the lower abdomen. They had opened her and closed her again, inoperable. She was witness of Jehovah, so blood transfusions were not possible. So we had to treat her, and we did a treatment, whole body hyperthermia and different chemotherapies for 5 cycles. And you can see here the tumor is all gone. Here's a normal uterus back visible. This lady had surgery. The tumor was taken. A remaining 5 millimeter lymph node was found. That was all. She had 2 other cycles of treatment, and still nowadays she's happy and healthy. So also good results. Oh, here this is a patient with testicle cancer. He had already the main treatments and came to us with lung metastasis, large liver metastasis. In a wheelchair he came, and this is a few months later. Also a very recent patient. He had now here a complete remission of the lung and just a little left in the liver. So this is a hyperthermia treatment, just a short excursion. Now let's talk a bit more about the benefits and aims of complementary treatment. The aim of complementary treatment is not so much to kill the cancer, it's more the other side, to support the body so that the body can fight better against the cancer. Support of the self-defense mechanisms, get the body stronger, because often the cancer and the treatments weaken the patient. A better quality of life by focusing on the immune system, on detoxification, improvement of organ function, mental strategies. And the important thing is, compared to chemotherapy or radiation, complementary treatments have no or little side effects. And here's a patient, for example, with metastatic colon cancer, getting chemotherapy. After 1 cycle, he had to stop the chemotherapy because of side effects resulting in progression of the disease. Then the patient came to us. He got the same chemotherapy, but he got in addition complementary treatments, and he had no side effects. The normal cycles were possible, and success of the therapy, so the treatment worked. So this is the difference. So what are complementary treatments? Supplements. So should you take pills? And you see here, I had patients who looked in the internet what they find for cancer treatment, and they found many different options, and they also met many therapists. And I had one patient coming to me. She took 256 tablets a day, and she asked me, please tell me, what can I leave away because I have so much pain in my stomach. And so the supplements, they are not, it doesn't make sense to take millions of tablets as supplements. You have to look what substance or which substances are studied well, where is evidence, and up to now it has been shown that, for example, antioxidants like selenium, like zinc, like vitamin A, E, C, that these antioxidants seem to be very important, because there are studies showing that if patients have a lack of this antioxidant in their serum, they have a high risk to have more side effects of chemotherapy. These are recently published studies in children, for example. So it makes sense to supplement these antioxidant vitamins, especially when patients cannot eat well, for example, around chemotherapies or radiation. But you should not do that on the days of the chemotherapy, because there can be interaction. Then mistletoe treatment, another example. You see here the mistletoe plant in the trees, and this is a traditional treatment. And Rudolf Steiner, an anthroposophic medical doctor, he said, oh, like the mistletoe, the lump in the tree is like the cancer in the body, so the extract must help against cancer, which is not logical at all. But it was used for more than 100 years now, and it has shown in recent studies that there are so-called lectins working, showing that the mistletoe can help to improve the quality of life and to activate the immune system. These are injections possible under skin, causing a red spot. Also infusions are possible, intrapleural therapy, even intratumoral injections are possible as an alternative approach in certain cancers. And there are also some studies about the results: improvement quality of life, reduction of side effects, and also successful treatment of pleural effusions. Even tumor remissions are published in some cases. Japanese mushrooms is maybe the mistletoe of the German, is a mushroom for the Japanese. It has shown that Japanese have very often stomach cancer, and there are studies showing that if they take shiitake or maitake together with the chemotherapy, the outcome is better. The beta-glucans seem to be the working agents in the mushroom, and this can be also used in colon cancer as an additional, and gastric cancer or stomach or colon cancer. Physiotherapy, very important. Not much studies about that, but everybody knows that it works. Everybody knows that massage does well, that fungo does well, and this is so it's very important. as a treatment, as also accept as a treatment. So you can do, for example, if patients have pain after surgery, or if they have stiffness of the bones or the muscles after chemotherapies or radiation, you can do physiotherapy to help them, to relieve the pain, to mobilize the patients again. This is very good. Also, if they have, after radiation, lymphedema, a swelling of the legs or the arm, you can do the lymphatic massage. And reflexology, massage of the feet, reflex zones for reduction of vegetative problems. This is the physiotherapy, the passive part. Also the active part, doing special gymnastics, breathing therapy, or functional strengthening, for example, in the fitness studio or muscle training. Because many patients with cancer, you see they lose their muscles and they get weaker, and this can be, the studies have shown that if you do a certain training at a minimum about 30 minutes a day, that you have improvement of your quality of life. And maybe a very important point at the physiotherapy is a personal attention, because wherever in the modern medicine you have a person who has half an hour time for you, only for you, to treat you. So this makes also a big thing. Here see a patient with lymphedema, and who will be a candidate for the lymphatic drainage. Psycho-oncology, also a very interesting topic. A study of Spiegel has shown years ago that patients with breast cancer, here in this case, treated after diagnosis when they are in the shock for a year with a psychological support, that they have a better outcome. The treatment group lives longer. Normally you would say, okay, if this is shown, then psycho-oncology should be used for breast cancer patients, because we know that cancer, if you have the diagnosis of cancer, it's a shock. You are in palsy, you're sometimes not able to react, to do anything. And this is not a good start in a therapy. And, but it's not offered. So because of financial lack, psychological treatment usually comes very late, and sometimes too late. What can patients do themselves? They can do a regular activity program, and they can look that they watch a health-oriented nutrition. Here, for example, physical activities, sports outside, whatever you like to do, and the daily exercise program, 30 minutes per day, brisk walking. It's not the homework. Some people come, I do so much at home, I don't need any exercise. No, this is not enough. It should be without stress. You have to be outside, brisk walking, cycling, dancing, whatever you like to do. Gymnastics, 30 minutes per day. Studies have shown that, for example, in patients after breast cancer, even the survival rates are improved about in the same rate as with the medication tamoxifen, which about 12%, which is very good. So which is a simple program you can do yourself, including the effect on your quality of life, that you feel fitter, stronger, and better. And of course, if you're tired after your sports, you look what to eat. And if you eat, then there are many things. Also, what should you do? What is the best nutrition in cancer? There are about 50 different anti-cancer diets offered. Some with meat, some without meat, some with sugar, some without sugar, some with carbohydrates, some others without. Not one of these diets has shown to be of real benefit. It's just claiming. Even the radical diets of the Boys Cure, 40 days not eating, just drinking vegetable juices, has not shown. They claim 99% cure rate, but the patients who were cured were never found. So what has been shown in large studies, that so-called Mediterranean-style food is the best, so rather vegetarian, so not so much meat, more fish than meat, more whole grain products. Everyday vegetables and juices are important, and fruits. Reduction of sugar and fat reduction, so that you don't get too fat, because being fat is a risk factor. And of course, if you have the disease and if you get treatment, you need an adapted nutrition to disease and the therapy, because if you have chemotherapy, you may not like everything, so you may not like and may not tolerate whole grain products. So this is also important that you watch this. So the German schnitzel, which covers a dish, and some pommes frites, is not the best to eat. Yeah, it's not healthy. But the Italian scallopine and some pasta and a good salad is something better. Yeah, so you can understand. I think the Polish schnitzel is maybe like the German schnitzel. Yeah. Okay, a strict diet is without benefit. And now this is, I think, one of the very important things. This is the newspaper report after the 2 years ago biggest cancer conference in Germany of the German Cancer Oncology Group. And the headline after that newspaper was not new medications found or new tablets found. The headline was complementary medicine, oncologists change their minds. They accept more and more the complementary treatments. So even in smaller units now, working up to now, only conventional standard treatments, they start to offer yoga, they start to offer meditation, they offer selenium as supportive treatments. They suggest patients they talk with patients about the food style, they support patients to do some sports. So this has changed a lot. And even at the university hospital in Gießen, where I give lectures, a student group has built up together with the decan of the university, and they want to make a curriculum during their studies about complementary medicine, which I think is very important that already the students of medicine learn what patients wish, because patients ask for this treatment. They need a competent partner to talk with. So the medicine of the future, and this I'm quite sure that this also happens here, because I see here the university hospital on the other side of the road, and I see here the treatment with a complementary treatment. So the medicine of the future is a guideline-based treatment strategy to get the best results of the conventional medicine, plus, in addition, complementary treatments. Thank you very much.